Good morning, good afternoon, whenever you're seeing this. Does any of y'all know a disease named after a famous baseball player? Anybody? Well, if the answer is no, today I am going to be talking about Lou Gehrig's disease. That's what the disease is commonly called, but it's also called ALS. It is a neurological disease that nerve cells and muscles are weakened. And it's named after a famous baseball player, and his name is Lou Gehrig's disease. Lou Gehrig. He was diagnosed with it, and he passed away within 2 years of being diagnosed with it. My credibility for this disease is my uncle. He was diagnosed with it several years ago, and he passed away from it. And the research that I done for this is from USA Today and also 2MDs. And of course, I've known about this disease from my uncle. When he was diagnosed with it, me and my family kind of did our own research about it. And today I'm going to be talking about the symptoms and the signs, how it's sort of kind of diagnosed, and the life expectancy of this disease. So the first thing we'll be talking about is the signs and symptoms. The signs and symptoms, there are a lot. So the first one is pretty much muscle cramps, muscle twitches, tight muscles, muscle weakness, slurred and nasal speech, difficulty chewing and swallowing, and the loss of physical function such as walking, talking, eating, and breathing. And it pretty much breaks down the brain and spinal cord. It breaks it down and it delays the brain's messages to the muscles. And with my uncle, when he was diagnosed with it, it started off as a very, very distinctive limp. So pretty much it started off in his legs. And it kind of worked its way up. The first thing that it took, pretty much his ability to walk. So after the limp, it kind of went up to him being bound to a motorized wheelchair. And he was in that for a few months, maybe a year. Can't really remember, it was so long ago, but he was in that wheelchair for a while. And then it got to a point where it continued to work its way up, and it took his ability to use his hands to move the wheelchair on his own. So with that, he had to have help getting to places, which my aunt helped him a lot through this disease, and without her, he probably would have not lived as long as he did with it. But it took his hands, his arms. Then it got to a point where he was stuck at home with pretty much to a chair or to the bed, whichever one. So it kind of worked its way up, and the last thing that it took was his breathing, and that's how he passed away, in his sleep from not being able to breathe. So how it's mainly diagnosed, there's no test or procedure to say you definitely have ALS. There isn't one at all. But there are some clinical examinations and tests that can limit the diseases that may mimic ALS. And there are a lot of those, so I'm just going to name a few. One is pretty much a spinal tap. Pretty much get a needle, look at the liquid from your spinal cord. X-rays, pretty much looking possibly, of course, the spine, certain muscles, something like that. A muscle and nerve biopsy, maybe the limp, maybe they want to look further, maybe something like that. And also you can go through a neurological exam, pretty much going through motor functions, moving arms, seeing how far you can move it, how much tenseness. So pretty much if you go to a doctor and they say you have ALS, the ALS Association pretty much tells you that if you are, go get a second opinion from a ALS specialist. just to make sure, because sometimes maybe you may not have it. It's just a disease that you may have that kind of mimics ALS. So that's pretty much why they're saying go get a second opinion. And with this, 5 to 10%, another family member could get diagnosed with it. Genetics, there are some that can be caused by genetics, so it's pretty much hereditary. That's a little rare, but that can happen. And in some others, you pretty much don't know why you were diagnosed with it or how you got it. There's no way of saying how you got it. There's no other way. And now the life expectancy, there is no cure for it. Time is pretty much against you. But there are some medications that can slow down the progression of it, kind of slow it down. Pretty much they are giving you 2 to 5 years from being diagnosed. My uncle lived more than 5 years with it. So there is also a possibility that you can live more than 5 years that they are giving you. And some patients that are usually diagnosed are either 55 through 75 years of being diagnosed. In the conclusion of this, pretty much I have told you signs and symptoms of it, how it is possibly diagnosed, and the life expectancy of it. And it's pretty sad to watch. It was pretty hard for me to watch my uncle go through it. But if you want to help out, there is a website you can go to and help out, or even learn more, or maybe you might know somebody and want to give them more information to maybe calm them down or maybe help them through it. And now you know a disease by a famous baseball player, and hopefully this helps you or helps someone that you know has it, and you know a little bit more information about it. And hopefully you don't have to go through it like me and my family did. But it's a really sad disease, and you can go look it up on a website, or you can also Google it to kind of help you out with that. So hopefully y'all have a great day.